All righty. So it looks like most folks are finding their way to our Zoom session here. My name's Cole. I'm the one who sent out the email to you guys. Thanks a lot for making time to make this. We also have several of our residents on this chat as well, which are time for you guys. Feel free, stay muted, video off, whatever. But obviously, if you do have questions, you can put them in the chat. You can unmute yourself and kind of interrupt anytime. This is just meant to help you guys out. We're here for you guys, and we want to set you up for success. But without further ado, we'll just get started. I just have a little presentation and just kind of covers basics of rotating. Some of it is, I'm sure, pretty basic that you've already come across in your planning, but I'm sure we'll touch on some helpful points as well. All right, so how to crush the ortho away. It's super exciting time, rotation season auditions, but it can also be kind of grueling. So these are just tips for an overview of what it means, especially in the military. Our program here is a hybrid. So we have both military and civilians or non-military applicants. So they deal with both the military application process as well as ERAS. So we tried to keep it somewhat general to account for the differences and just address how to succeed in general as a med student on an ortho away rotation. So we'll kind of just talk about structure, home and away rotations, timeline stuff, and then nitty gritty, how to be prepared, evals, letter of recs, interviews, some presentations, and then some advice at the end. So in general, these rotations are going to be 4 weeks long. Some programs may have like 2-week rotations as well, or they're flexible based on your availability. Folks have different kind of schedules. Every curriculum is different, and different programs have certain availabilities based on time of year. But usually during those 4 weeks, you kind of have a week on different services. Usually you'll spend some time on trauma, but then you'll have kind of program dependent services like sports, hand, spine, joints, whatever they have going on at the time. And oftentimes we'll spend a week with their program director, which is a great time to get exposure to someone who is pretty influential as far as the resident selection process goes, and they can be in any one of these fellowships. But during that time also, you'll take a few call shifts, take part in their academics, hopefully get to know a lot of the residents there to feel out the program to see if it's a good fit. And some may have a medical student presentation as a part of their rotation. We do here, not all programs do that though. And so generally people have a home and away rotation. Home rotations obviously is only if you're with a hospital that has a home orthopedics department, which not everybody has one of those. Sometimes they'll have an affiliated ortho kind of hospital nearby that you can go to, but these are a great resource for you because they have some investment into you as a product of their medical school, and they want to help you succeed on these rotations. But so they're generally lower pressure, and this department can be familiar with you from things like, prior sort of shadowing or research projects, or maybe even old residents that went to your med school that you're friends with. And these can really set you up for success on your away rotations at foreign programs that you don't have any experience at. So these are usually scheduled just as part of your, school scheduling stuff in like the springtime. But as far as away rotations goes, these really kick off during the summer. Again, it depends on your school schedule. Some people start now like May time, but a lot of times it starts, around July, and that extends to roughly September, October. And the locations where you go to kind of depend on where you're interested in going. But identifying those early is really important because some programs, they require applications to even just rotate there, as opposed to identifying where you want to go and setting that up just with a program coordinator or something like that. So that's just kind of general stuff, but you are probably already familiar with these as this is kind of about to get started. And general timeline here again, so you make these preparations kind of in the springtime, travel, life events, trying to minimize disruptions to these rotations. It's really important as best you can for while you're on these rotations to not have anything kind of get in the way of focusing on trying to perform well. And so June kind of through August and even later really is like the peak rotation season. If you're in the civilian side, and even most military folks will be applying through ERAS and collecting the components of that application. And then later in the fall, September through November, You may still have rotations during this time. You may be taking step 2, which you have to do at some point. The military application is due before the ERAS application. I believe it's mid-October, and then the ERAS is a little later than that. And then, kind of following that, you'll finish your rotations, and in the fall, even towards the next spring, you'll have your interviews, make your rank lists, and match. The timelines are slightly off with military and civilian matching processes. The military match happens in December. The civilian happens in March. And so now I'll hand it off here.
I'm going to introduce you real quick, or interrupt you. For the ERAS, so in my application cycle 3 years ago, they said there weren't going to be any civilian slots. And sometimes they say that, and sometimes everything changes. So even if I don't know what the guidance is this year for everyone applying, at least that's military, but make sure you do the ERAS application and at least apply to several places that maybe not, I want to say like safety nets, but places that you should be able to get an interview to, because you don't know if you will or will not get that civilian slot. And the last thing you want to do is get the civilian slot from the military match and then not have even applied to ERAS, because then you're kind of out on a limb and you're basically stuck being a TY at that point.
Mm-hmm. Yeah, great. So now one of my colleagues, one of our current interns, Alexis Sandler, is going to kind of talk over some nitty-gritty details about exactly when the time for the rotation comes, what you can do to really be prepared for that.
Yes. Okay. So to get into this part, the first thing, kind of like finding where and when to show up, you should get some direction from the residents. Make sure you get the resident's phone number, check in with them, what time they round, what times things start, stuff like that. And then the actual like getting to be there for the rotation actually starts months earlier. So you have to submit all of your vaccines, all the forms, make sure you have all of your records good to go. Your school usually has to have an agreement, all that sort of thing. But then communicating with the residents is super, super important. Usually they'll know the cases for the next day. They'll know to tell you what to prepare for, all that stuff. And then I think the kind of one of the biggest things is studying ahead of time. So you should prepare for every case. On the slide here, we have Netter's Concise Anatomy, Anki, Miller's Review, all great resources. I have a couple here. Netter's Anatomy, it's awesome. Dr. Thompson is actually an Army guy, so it's a really kind of a cool connection. But this is a fantastic book for your anatomy review. Dr. Nabil Ibrahim, I believe that's his name, makes awesome anatomy videos also. So those are a really good idea to check out. In terms of like other small things, Pocket Pimped is a really great resource. This is kind of more like PIMP questions that you might be asked in the OR. Shouldn't be like the primary resource you use to study, but it's a very helpful thing. And there's an Anki deck on it floating around online on Reddit somewhere. Also a really good one. So then this book, which you can also find for free online. I'm not advising you to do that. I'm just letting you know that is an option. Hoppenfeld's Surgical Approaches, fantastic anatomy, and it's a really good idea. I have an idea what's in the way, what you're going to look for. Although it has like the diagrams are fantastic in that one, so that's a really helpful resource. And this one too, I think it's a little less known, but I really like it. It's Hoppenfeld's other one on like physical exam. This is a nice like thin book that you can bring to clinic and kind of look up an exam maneuver if you're in a certain clinic that you haven't been in before. If you're, for example, if you're in a shoulder elbow clinic, the shoulder exam is pretty complex. There's a lot of parts to it, so it's nice to have kind of a resource you can look to. You should also, before that, check out Ortho Bullets, of course. Ortho Bullets is a phenomenal website. Do some of the questions there for cases. That'll really help you too. ViewMedi is an awesome resource. It has like surgical videos done by professionals in the field. Some of it's going to be above like the medical student level. Totally fine, but it's still really good exposure. And usually their videography is like a very high quality and a really helpful to watch, better than like getting on YouTube and searching like Trimal or something. And then so also same thing, check out basic videos on suturing, applying splints, all that stuff. I believe the Seattle videos are like, I think some of the best. They have like a couple hours that are divided into each type of splint. It's a really good idea to review that beforehand so you can have an idea just how to do the basic splints. And then, have a suture kit, do some practice at home, stuff like that. No one expects you to know how to do this stuff before you start, but it really helps be familiar with the mechanics and the kind of the process before you get going. Mm-hmm. So then evaluations, we're not going to spend much time on this. Usually it's just like a piece of paper that we give to your medical school. And usually one of the attendings has to fill it out, or one of the chief residents, something like that. Don't get stressed about these. What is way more important is how you interact with the residents and the staff. We rarely, evaluations are not taken very seriously. in your application by any means. And then, so for letters of recommendation, you should know before your audition rotations how many you have and how many you're hoping to get from. Usually you should get one from a home program director. At the time that I applied, my program did not have a program director. We were just transitioning between several people. So it's not the end of the world if you don't have one, but it definitely helps to have one, at least from your home program or from a strong person in your home program who hopefully knows you well by then. You typically want 3 to 4 total. And then if you are headed to a rotation that you think you have a really good bond with the residents beforehand, sort of thing, and you've done research with one of the attendings, worked with them for a while, it's not a bad idea to get a letter from one of them. And then asking early is very, very helpful. And when you go to ask, it's really important how you ask, because you don't just want a letter of recommendation, you want a strong letter of recommendation from someone who hopefully can describe you pretty well. And then this is kind of another thing that's not talked about a ton, except like it's talked about a lot, but not directly or officially. You should offer to help with your letter of recommendations however you can. Most of the surgeons who you will rotate with are probably incredibly busy, high case volumes, working hard. They don't have time to sit down and get to know you as well as you would want them to show like they did in their letter of recommendation. And that's completely fine. If they've seen your work ethic, seen how you are, they can probably write a strong one, but it really helps if they know more about you. I think it's not unreasonable to offer, you have to, do this tactfully, but not unreasonable to offer to write or at least make an outline or a bullet list of what you would hope a recommendation would say. On the other side, though, I think I've seen a few where people speak way too strongly of themselves, and you don't want to be that person who comes in saying like, yes, that person, like you write your own letter saying that you operate at the level of like a PGY2, like that's ridiculous. Don't shoot that high. But being like reasonable and mentioning direct facts of things that you actually did that you think were helpful, I think that's a pretty reasonable place to start. And then, oh yes, the last point, following up with the letter writer frequently until it's uploaded. Very important, very important. I think I have a lot of friends who there was like a bunch of situations where someone doesn't know how to upload the letter correctly. They have problems with the website. They can't access their login, sort of thing. And you don't want to be stressing about this the night before. You want to hopefully have that kind of squared away beforehand. And again, keep reaching out to them. This is not a one email sort of thing, and then you expect it to be uploaded. Like make sure it actually gets uploaded. You can check on your end, see where they're sitting, etc.
Yeah, and for those of you in the military, pipeline, I think there's one person who kind of gathers all of your application materials. And I don't recall if your letter writers directly email that person the letter like on your behalf with sort of your information in the subject line or something, or maybe they send it to you and they send it, and then you pass it on to that person. But that could make it a little like harder to know, like if they've submitted it, like in ERAS, you'll get like a notification or something, but like you in the Army system, it's like a lot of like you're just emailing documents. And so that could be tough to keep track of, but do your best to kind of find out how that gets done.
That's a really good point. Yeah, I guess in our year, we just emailed them to the coordinators. And the nice part was that like the coordinators were super responsive. So I remember I emailed them like, hey, did you get the letter from XYZ? And they would say, yes, I did. Thank you. And then end of story sort of thing there. So interviews, know when a formal interview will happen on your rotation. And then, each program is a little different with how they do interviews. Sometimes there's like an interview day where everyone kind of like, you do kind of like a speed dating sort of thing where you move from table to table. Other days, other programs, it's like set up a time to interview with these 7 attendings and make sure you hit all of them sort of thing. Or just interview with the people you rotated with and the program directors. It's super different based on what program you go to. So kind of try and figure that out beforehand. Usually there'll be some sort of information in that in your first initial information session or one of the pamphlets they give you with like a vague outline of what the rotation is going to be like. You should have copies of your CV that look nice and are updated and everything, and dress attire for military, ASUs or GSUs, I suppose, whichever you have at home. But make sure it looks good and make sure you have all of the parts and make sure that you're like within guidelines and regulations. That's kind of important. It doesn't look great if your hair looks like crap. When you worked so hard in this rotation, and this is like the kind of one chance where you get to meet some of the people that you didn't get to actually work with, and that's their first impression of you. So then, and that kind of only applies to military. For civilian side, make sure you look nice, but you don't have to like have your hair in a certain special way. I don't want that to be misinterpreted. So then other ones, usually the 2 to 3 short one-on-one interviews with the PD chair, and then others like staff and chief residents. So have the basic, like, you're going to be asked, like, why do you want to do ortho? That's a common question. Have a good answer for that ready. Have a good answer for all of the common questions ready. And then ask the format ahead of time so you know if it's going to be like a dialogue or if it's going to be a group interview or if it's going to be kind of just you going in and talking. I think something just kind of like the important things to remember during an interview is no one really wants to hear you ramble on for 3 hours. Make sure it really helps if it's a little more of a conversation and you ask appropriately timed questions and you make it a little more personable than just like, you talking about yourself the entire time. I've heard some interviewers like to be asked at least like 1 or 2 questions during an interview, and I've heard them complain when they aren't. Not at our program, other places, but just kind of something to keep in mind. It's also helpful too to have something that you actually enjoy talking about and are passionate about, because that really shows during an interview.
Aside from orthopedics.
Yes, aside from orthopedics.
Personal things.
Yeah, to make you kind of stand out. And then and this is a hard one too, but try not to be like too anxious during your interview. I know it feels really scary and everything, but at the end of the day, remember, it's a person who's deciding if they want to have you to their program. It's not the end of the world. If you say one little thing wrong, it's not going to mess up your entire interview. So, if that can help calm the pre-interview anxiety, just kind of keep that in mind. Something that I've heard a little bit of discussion on in kind of like bigger forums and on our individual residency level is what to do if you're asked inappropriate questions during an interview. And this is a really hard one because what defines an inappropriate question is pretty much anything that you feel uncomfortable asking. For some people, this is whether they have families, whether they have kids, whether they want to have kids, stuff like that. I think you have a couple options. You can answer it if you feel comfortable doing that. You probably, if it's an inappropriate question, you probably don't. And I think that another, there's a very tactful way to just be like, oh, that's an interesting question. Can I ask why, or what's your interest in that sort of thing? You can kind of turn it around best you can. And hopefully it doesn't happen to you, but I've heard some stories of it happening, and it's kind of a hard thing that you don't really want to bring up. But then make sure afterwards, if you do feel like you were mistreated during an interview by any means, you should talk to someone about it, preferably a resident at the program or something like that. And again, not saying any of this is happening actively all the time, but I think there was a really interesting talk. I forget what it was, but it was last year sometime. Someone brought this up, and I was actually really glad they did before I interviewed, because I had never thought about these things that could happen during an interview. So just something to keep in mind. And then presentations. So typically in most rotations, you will give some sort of presentation at the end. There's a couple good strategies to do that. You can talk to the residents, figure out what a good topic would be, or think about a cool case you saw at the beginning and kind of research more into it. Or if you have a special interest you want to explore, stuff like that. Again, it's one of those hard things. You have to remember, probably the least in the room about anything orthopedics. And it's really important to keep that in mind when you're making these presentations. Make sure you're citing literature, make sure you're not making broad generalizations, and make sure you're clear on the parts that you don't understand. And that's okay. I know just mine in particular, I did orthopedic manifestations of non-accidental trauma. I have a long history of research in non-accidental trauma. So I knew quite a bit about the subject, and I was able to speak relatively intelligently about it. The orthopedic world, of course, I was just coding what types of fractures they had. I wasn't actually looking into the specific fracture patterns or how early they were caught by the ortho teams, anything like that. But I had some interest in this subject, and I was able to kind of know where to look for the information I wanted to present. I think that really helps. Practicing beforehand is critical. And then the last part, reviewing with at least one resident prior to presenting, is really, really important. Because otherwise, you need a sanity check by someone who's seen a bunch of presentations or who's made a bunch of presentations, and it really helps to have that extra voice kind of reason. And especially if you feel super nervous, they're probably going to tell you did a good job, and then hopefully give you some helpful feedback too. So.
Yeah, and at least at our program, so this is done in front of all of the residents, all the staff, and a lot of times if you don't interview with those attendings, this is the only time they'll see you and get to hear from you. And while different attendings have different levels of involvement with resident selection, it's a good chance to leave a good impression if you have a polished presentation as well.
Yeah, that's so true. And I think that too, you end up presenting a lot in residency. You're presenting patients at morning report, case conference. You present your academic lectures, stuff like that. You go to conferences to present research. You end up presenting a lot. And I think it helps to show that you're a strong presenter and that you're going to do a good job presenting those topics in the future when everyone has to sit through them. All right, handing it over to Cole.
So first point is just show up on time or be early. You should always be early to whatever. If someone tells you, the morning report starts at 7, you should be at least 10 or 15 minutes early. And that's seems pretty self-evident, but sometimes that's lost in translation and people just show up. at this, the right time or even later. And that can be a really, really bad impression, especially if it's on weekend, when it's a very small group or what have you. If you're transitioning from, working at one hospital to another during the day, sometimes there's limitations to how fast you can travel, obviously, and we understand that. And if you are going to be late for any reason, gas, whatever, just be transparent and let us know. And, obviously we don't hold you accountable for that, but, just being early is obviously really important, not just for orthopedics, but for everything. And then ask what you can do to help, and then anticipate the needs. So I think a common misconception with medical students is that they're just there to shadow and they're not there to like be a part of the team. We really do treat medical students as a part of the team, and you're very valuable, whether that be helping in surgical cases or even during consults. I think some of the most profound impacts that medical students have had on me are ones that are very proactive, and they seek out opportunities to help and to show themselves as a valuable member of the team. When I was a junior, I'm starting at midnight, I'm not going to be a junior resident anymore, but when I was taking a lot of call, especially like as a 2, when we're down at our trauma center, we're the main primary pager holder and the main person that medical students rotate with on the weekends. And if you get a consult and you're finishing notes or you're doing something, and that you just got a distal radius that you have to reduce, and the medical student is, oh, I'll go get all the splint supplies ready and I'll meet you there and I'll roll it out. Even that doesn't sound like it's profound, but it really makes me shocked a lot of times, and that makes me think, wow, this medical student's really on it. And in my situation, I'd let you reduce the fracture. I obviously teach you, but we'll walk you through it. And I think the more that you show that you're eager to help and learn and be part of the team, the more that you get to do, whether that be closing or reducing fractures, putting traction pins in, and things like that. The next point is always address attendings and residents as doctor unless otherwise told you so. That's not to stroke our egos. If you talk to any 25 of us that are residents, if you call us Dr. Patrick, I'm immediately going to tell you to call me Cole. And I think that's the same for all of us. I think that's that's a safe thing to do, especially attendings. You should always be calling attendings doctor, but just addressing people by their title, whether it be doctor or what have you, or their military rank, but no one really uses that. But we're pretty casual. We are very friendly, and if you're going into ortho, that because that's kind of the lifestyle. But we'll tell you to down dress it as soon as you talk to us. But you can all call me Cole. You don't have to call me Dr. Patrick. And then again, I think they already mentioned it. Asking for the surgery schedule. Sometimes if you're on a trauma rotation, you're not going to know all the cases that are on, and you may be. You may prepare for some OR and something might come up and you might get transitioned to another OR. And in that case, obviously you're not going to be fully prepared for the case, but knowing at least the basics, hop and fells, like Alexis was saying, just knowing the surgical approach and the pertinent anatomy that you're going to run to, that's basically all we expect you to know in the operating room, aside from suturing. So if you can answer those 10 questions, that really shows us that you prepared and you're ready to go. And knowing the schedule ahead of time is a great way to do that. Obviously, ask residents questions. Being inquisitive is very encouraged, and we like to see that. There is a point where that can be too much, but like you got to read the situation. I think that's just part of social cues. If it's something's going bad in the case, and you're like, oh, Dr. Adler, what made you want to do trauma? And you just propagated the fracture into the joint. That's not the best time to ask questions. Not that you would ever do that, but read the room and ask questions appropriately, especially if you have like downtime in between cases and stuff. And then the last point, go to social events, check out the area. You're not just auditioning for a slot, like you are auditioning us as a program too. And I think that's something medical students don't think a lot too. You're trying to decide if these group of residents and staff are going to be people that you want to learn from and develop with. So getting to know them personally, whether it be in work or at social settings, is a great way to do that. And then exploring the surroundings is obviously great too. If you hate the desert and you want 300 days of rain, this is not the place for you. Although most of us love living here, but you need to know what you want out of a program too. And then what not to do. Talk down on other rotators. That's really big. You should never say anything bad about anyone. Once you're a resident, I guess you can do whatever, but it looks really bad about when people do that, and they do, and it's kind of off-putting. Don't expect anything like doing procedures, reductions, surgical, hammering in the tibial nail. I and a lot of us are, the more comfortable you are, the more you're able to give up as a resident. And residents are at different levels in their training. Some residents may not feel confident or comfortable doing a certain case, or maybe even at that same level, resident X is like super confident, comfortable, and will hand off parts of the case to whoever's below them, whether it be the intern or the medical student. And some people aren't. And just because you had one experience with one resident, you got to drill the ACL tunnel, or you got to do the distal, you have to drill and fill, a plate, doesn't mean that that's like the expectation during the next case. Obviously, we like to get you doing as many things as we can. If it's the end of the day, it's like 6 p.m., you're trying to finish the last case, residents might just do it because to clean up the day and get out of there. So, but that, what I said earlier, the more you show effort and the more you show interest, the more you do. And I know that's a fact, at least for me and a lot of us. Refuse to leave when no one's there to work. I think that isn't super common. I guess that is kind of common, but if we tell you that the day is over, and even we have to be there from X amount of time to X amount of time, at least on trauma. But if things are at a lull and we know that you have something going on the next day, you're presenting or whatever, if we tell you it's okay to go home. And then treat residents attendings like close friends. I think that is true to an extent. Obviously, some of us, you may have relations with us, whether it be through med school or other friends or through research. And I think we are very friendly people, but you can take it a step too far. We're still at a different level of training, and then obviously once you become indoctrinated in the program, things change. But being too buddy can be off-putting as well too. And then offer unsolicited input on patient care. Yeah, that's true. Like Alexa said earlier, you unfortunately know the least amount of orthopedics, and bringing up questions is one thing, but then asking, well, why aren't you doing this? Dr. So-and-so at this other program did this. That's not great either.
Do any of the other residents have kind of thoughts on big do's or don'ts on behaviors or activities that students should look for or avoid during their rotation?
Yeah, I'll give the senior resident advice, just because I think as med students, it's really fun to be in the OR with the chief or the senior. Obviously, like, we want to try to get you in the OR as much as possible. But something that I notice are the students who, when we're done with the case and we're at a county hospital with a long turnaround time, they'll just kind of sit in the workroom while the intern or the PGY2 are getting his or her teeth kicked in with consults and splints, and looking at radiographs and seeing a fracture that's getting ready to get reduced in the emergency department, and they just they forget that the junior residents are there too. When I, as a 4 and a 5, when we would rank med students, I always ask for the junior resident opinion, because I'll rotate or work with you last year for no time at all. I'm a graduating chief, but the 2s and the 1s have to work with that person for 3-4 years, so it's really important. So just because you're hanging out in the OR for the day, obviously you don't step on your co-rotating medical students' toes, but there's always something else that can be done. And the students that have really impressed me are the ones you get out of the OR, you can't find the med student, you maybe ask hey, do you know where so-and-so is? Oh, they ran with Cole Johnson to go do a reduction in the emergency department. That to me is an incredible testament to dedication and love of ortho and willingness to work hard, versus you're just sitting there, not even reading about the case, not working on a presentation, not doing something productive. You're just doing crazy stuff. Sorry, my dogs are going. One of them is. So yeah, that's something that I've realized comes up a lot. when we rank bench students. It's like, I may be like, oh yeah, they were great in the OR, great hands, super helpful. And the juniors are like, screw that person. Like they didn't do anything to help us. And no matter how much I love doing the OR, like I'm going to side with my boys and girls there and pick the person who helps the juniors out, because their life is way worse than mine.
Yeah, I completely agree. There's when you see people like that in between cases helping, that is extraordinarily impactful, and I think it makes everyone think highly. And then when that happens, obviously, the seniors talk to the staff, and word of mouth spreads too. So
I think one of the other things that hasn't been mentioned yet, consults, cases, things like that are important. Everyone in surgery hates clinic in some degree, but I do think that as a medical student, that's one of the biggest areas where you can demonstrate, what little orthopedic or a lot of orthopedic knowledge that you have. As you're seeing patients and you're talking to them with the resident or often the attending, you're going to get a lot of kind of one-on-one time with those people, talking through, x-rays or post-ops or whatever it is, and be able to kind of demonstrate your interest and your ability to kind of work through patient problems and indications for surgery and things like that.
I would just add one more thing, and that's, 95% of you guys are super smart. You guys are applying orthopedics. And so you're obviously interested, you're go-getters. Just remember, like, you'll have your chance to show how smart you are. You're not trying to show anybody up. What we really want to see are people who work hard and who fit in with the program. And so I think that, like, 3 words, it's kind of stupid, but just be cool. If you can fit in and you can show the residents that you are able to mesh with the network and the community that's there authentically, that's probably the most important thing you can do on an audition rotation. Aside from just not like genuinely fuck everything up.
And I don't think he means be cool like Josh Hanson's version of cool, because it's not actually cool. So he's just trying to, be yourself, be relaxed. That's
okay. So I think I already talked about this, but treat the entire rotation as an interview. I know it's very stressful, especially if you're there for 4 weeks. It's easier to get through 1 or 2 weeks, but 4 weeks is kind of a long time. You may be tested physically, like with hours and things like that. Obviously, we never put you past our hours, but it can be tiring, especially if you're on a trauma block. You might be there for a long time, more than you've worked in the past, and you're going home and you may be studying for the next case. But always, have an upbeat attitude. And it goes to the, I think there's another point later. It's like, bad impressions can be worse than good ones. If you have like a singular bad impression, like a really bad impression, that can ruin in 27 other days worth of excellent rotation where you got along super well with people. Like if you, and it's never happened, but if you cussed out a nurse or something like that is just a death sentence. So just be cognizant of what's going on. And I know it's stressful, and I would never want to go back through rotating as a medical student, because you're very high strung and stressed, but people are watching and observing you just as much as you're observing them. And just try to not mess up too much, I guess. But yeah, both resident and attending opinions matter. I think I would say, initially I would say like residents' opinions matter more, but I don't know, I think attendings also have, backdoor conversations that we don't see, obviously. And, we can present our best picture of what we think our match rank list should look like. And that sometimes it changes, but a lot of times they do really value our opinions. And, if you're a stellar applicant, you're going to end up at the top on both of our lists, because they kind of cross-check those. But if you're a little bit lower on their list, but you're our number one and we fight very, very strongly for that person, they take that into consideration. But obviously everyone's opinions matter. Even, ancillary staff like our program coordinators and nurses as well. And I think I already talked about the bad impressions being better than good ones, but good impressions can outlast, neutral impressions by a long shot too. If you have, one clinic session where the staff is really grilling you on, shoulder instability or whatever, and you just keep answering all the questions right because you wrote a paper about it or you were involved in some research, and they're really just testing you to see how much you know, they may be blown away. And that might be your into that program, because an enormous experience like that, where a staff is really blown away by a medical student's knowledge that far exceeds even like an intern's at that stage, that again, the word of mouth spreads, and staff that may not have even met you already have a positive impression on you. And then again, just be happy. Orthopedics is the greatest specialty in medicine. All of us would say that. I think we're the happiest people in the hospital, and we get to do an awesome job. So have a good attitude, show up, and try to have as much fun as you can.
And I think now we'll get to some of the questions you guys submitted, as well as anything that came up kind of during this talk. But John Scaliato, I think, had some thoughts he wanted to mention regarding just the actual selection. So post rotation, what happens sort of behind the curtain on our end when it comes to medical student selection, at least in the military.
Yeah, this is again mostly for the military. I did the civilian fellowship match this year, which is maybe a little more like the civilian residency match, but I assume the resident or the civilian residency programs are probably fairly similar, but in the military, it's a little different. So how it works is, at least in our program, we have a rank meeting that's closed door to our attendings. Every once in a while, we'll have one attending there solely as an observer and a note taker, just so we can ensure that the residents' thoughts are captured. But and every once in a while, we get a little bit of like leading questions, like, "Oh, if you had to choose, one versus the other, who would you pick?" With no, no input or anything. But residents, we rank all the rotating medical students from 1 to whatever however many we have that year. And then at some point later, the staff have a meeting, and they usually invite the chief residents, because they can kind of serve as the voice of the rest of the program. Again, hoping that we wrote things down and captured it accurately. The way the military works is every year there are X number of military specific spots, anywhere from like 20 to 22 or something like that, depending on like Bragg. And now that they're taking medical students, or I'm sorry, residents full time. But anyway, they have X number of spots that are guaranteed every single year. And then there's a variable number of slots that are deferred out to the civilian sector. And it seems like for the past 3 or 4 years, there's been at least one every single year. And there's been like 2 or 3 some years. So there's, let's just say 25 slots, because I like fives. And then all your students are ranked. And this is every student, whether they interviewed with you, rotated with you, or didn't do any reaching out at all, are ranked from 1 to, let's say there's 50 med students that year. They're ranked 1 to 50. You obviously have your own rank list, where you hope that your top 4 or 5 or 3, however many you take in your program, are going to end up at your program. But every program generates a rank list from 1 to 50. The military loves order of merit lists. And then the program directors go to the joint GME selection board in November, October, November, usually November. And they then all compile their lists, and they rank every single applicant from 1 to 50 or 40, however many there are in the pool that year. The top 25, which are how many slots there are chosen to be selected that year. And then it goes by the program rank list. So let's say you are a student who really wanted to go to program A, and you smoked it at program A. You were a stud or a studette. Everybody there loved you. You're the best. And then you went on 2 other away rotations, and all you talked about was how much you want to go to those other programs, and you didn't put any effort. You maybe said something inappropriate. You acted inappropriately. These are all things that have happened. So I'm not just pulling examples out of thin air here. Then all it takes is one program to be like, "Yeah, I know you really like that guy or gal, but he or she said this about that person, or did this time." Now, all of a sudden, if every other program had that experience, you maybe won at one program, you now fall outside the top 25. Guess what? You're getting shipped somewhere else for training in the military. So you are effectively in the military trying to be in the top however many slots there are that year of applicants, and then hopefully you're number one on your list and the program's number one that you want to go to, they match up and you end up there. Once this all happens, let's just say program C got the consensus number 1, 2, 3, and 4 applicants on the list. Then the military sometimes does a little horse trade in the background to try to balance the program so that one program didn't get everybody good, and then one program got applicants number 20 through 25 or something like that. It's kind of a convoluted process, but at the end of the day, in the military, you are competing. I hate to say competing, but you are competing to be in the top whatever number of training slots are available that year. Which means it behooves you to impress every program you rotate at. It also behooves you that even if you don't want to go to a program, you call the program director or email the program coordinator. You act very professional. I know I'm speaking to adults, but still things have happened. And you say, hey, I haven't had the chance to make it on your program this summer. I'd love to talk to the program director, set up an interview so I could hear about the program. And then you get a phone call with them. And they may ask you like, oh, so, where'd you go this summer? And you be honest, tell them like, oh, I went to this program. I'd really like to go to this program because of family reasons or because of the resident bonding or whatever it is. But at the end of the day, I'd really like to be, orthopedic surgeon in the military. I'm happy to train anywhere. So-and-so. Some people end up then after interviewing with our program director or other program directors, they come, they do like a 1 week quick little rotation. They come for 2 days, whatever it is. As we mentioned, like anything works. But then when the JGMESB meets, even if you didn't rotate there, the program director will be like, oh yeah, but this person called me and they were super professional. They mentioned they want to go to program whatever. And then that program director now has even more of an incentive to look, it just helps you. So reach out to all the programs, aim to be really good everywhere you go. Army orthopedics or military orthopedics in general, but Army orthopedics especially is like the smallest big circle of all time. I've gone to big national meetings for the sports and shoulder elbow communities, and I run into all these former military people that I met on my away rotations. I met through mentors or mentees, whatever it is. But everybody talked and everybody knows everybody. And bad news or bad apples travel really, really fast, and people will find out. So at the end of the day, convoluted process, doesn't make a ton of sense all the time, but that's what goes on kind of behind the curtain. For the selection. And I'm sure there are things that go on at the JGMESB that I don't even know about at this point. But at the program level, we look at every single military applicant that year. Every once in a while, there's like a question mark, and we're like, who the heck is this person? They never reached out or that. So I hope that's reasonably helpful. And I probably rambled.
Yeah, thanks a lot. That was really, I think, helpful for them to understand. And that, is kind of, some of that is within your control as a medical student rotating to be aware of so that you can put your best foot forward. And, we didn't put really much in this talk about other parts of your application, like research or like step 2 scores. I think they're the only ones scored now, or, whether you had honors in all your rotations or were AOA, these sorts of things, like to a degree, sometimes those are within control, your control based off your situation at your school. So you want to do everything you can to sort of maximize that. And, these other things, you're going to stress about them anyways, but don't, do it too much, because all you can do is try to, leave a really good impression, work hard on your rotation and find a mutual fit, and kind of the rest is out of your hands,
All right, we'll wrap up. So these are a few questions that you guys asked. How much knowledge are we expected to know going into the rotation? What are some good resources? So as you all know, you don't learn any orthopedics in medical school except for how to diagnose an ACL and identify a hip fracture. Alexis already hit on all of the awesome resources that you can use. Anatomy, absolutely look at Hoppenfeld's. Again, there's online resources. And another one, if you don't have a book, is just look up AO anterior hip approach. And AO has incredible resources and very good graphics, and I use those all the time. So that's good. Another book you'll probably see is Handbook of Fractures. Honestly, I've never really flipped through this ever. Most of this is now on OrthoBullets. OrthoBullets should be like your main primary source, especially between consults reading up on cases. You should at least read OrthoBullets. They're very short, and you get the gritty nitty. And then Pocket Pimped. I didn't have this as a medical student. I think it's pretty good. again, there's that Anki deck. You're definitely going to get, I mean, a lot of questions that you may get asked in the OR are probably in this book. It's like 40 or 50 bucks. It's kind of expensive for how small it is, but it's definitely a valuable resource, especially, you know, if you're in foot and ankle clinic, you can just read foot and ankle and you may get a lot of questions you might be asked. Netters is, aside from ortho, it's the #1 resource you need to have. Netters Concise Orthopedics. If you're in between consults or in between cases, you should have this open as a medical student, in my opinion. If like residents are stuck doing admin work or whatever, and you know you're not able to have a conversation, this book should like never leave your side as a rotator. And this is more for like residents, I guess, but this high yield orthopedics book is really, really good. It's super thin. It's mainly like set for our in-service exam, but there's tons of stuff here that netters may or may not have that's super good, and it shows up on all the questions that we get asked. Obviously you're not gonna be able to rotate at every place. I rotated at 3, which I think is a lot nowadays, because it sounds like they're limiting the number of ADTs you guys have to 1. And then it's really up to your medical school whether they're gonna let you do non-ADTs or not. So you're not going to rotate every place. And that kind of goes down into picking your ways. I don't know how many of you guys are rising fours, because at this point, you know, you've probably already picked your places, but you may or may not know anything about the rotation except for the location. You might know Walter Reed is the hospital in DC or Maryland. And then, you know, you might know that San Antonio is the only level 1 trauma center in the DOD, things like that. But unless you've been to like webinars like this, where you can get a feel for the rotations and kind of the culture, it's really hard to make a decision. And I had no clue. I just kind of picked based off of location, first of all. And then I was told by word of mouth from a friend that El Paso is awesome. So I said, okay, I'll go check it out, kind of as an afterthought. And I'm really glad I did. So that's one of the impetus besides, or for making these webinars, to give you guys exposure to our program and what we're all about. And a lot of places now have Instagrams and things like that you can get a glimpse from, and you're always welcome to check out our website and reach out to any of us if you have specific questions. Is November or December too late? Yes, it is. I think your rank list is due in the middle of October and the match day is in December. So if you're a 4, November, December is too late. We typically have our resident rank list early October, I believe. Should you try to bond with residents on a personal level? I mean, I think you got to find a balance. Obviously, you know, interns are very, very close to where you are. I mean, interns are literally 1 year above you. Scans is 5 years, 6 years above you now. You just kind of got to feel things out, see how, you know, friendly. I think, again, all of us are very friendly, but, you know, keep it professional. And if you guys have mutual interests, like you like to both do triathlons, you like to climb, things like that, then yeah, you're more than happy to experience talk about those kind of things, you know, if you like sports, because, you know, at the end of the day, we're trying to find residents that we're going to spend the next, you know, thousands of hours of our lives with too. We want people that we want to mentor and that are going to become, you know, lifelong friends. So being friendly and creating those connections is great. And then how should you familiarize ourselves? I mean, I think just doing all the things that we kind of talked about, just have an open mind, be eager, be excited. You know, I personally love the medical, I just saw James's message, but I personally love the medical student cycle. I love meeting everyone and getting to know them both in a professional setting and then through the functions that we have. Because I think my goal and all of our goals is to build the best residency in the country, and you can only do that by bringing in fantastic new residents. So we're excited to have everyone this year and look forward to meeting you all.
All right, guys, I didn't see any other questions come through the chat, so we'll wrap it up here. Thanks a lot for everyone who joined, and especially all the other residents who offered their perspective on this. It's a really exciting time of year, and even though are going to be spending some time with our program. We're excited to have you in the future. And then, of course, you all got an email from me. So if you have any follow-up questions or curious about getting to know more about our program, we all think it's amazing, then you can certainly do that. This chat will be posted to our YouTube channel as well if you want to go over. I know some people joined a little bit later, so you can see it all there.